So moving on with substance abuse and dependence, this time focusing on nicotine and other drugs. So this first graph here shows that there has been a clear decline over the past several decades in use of cigarettes in particular. So why is this occurring? Okay, so there are a number of potential reasons that nicotine dependence is on the decline. Nicotine, the anti-smoking movement, the Surgeon General's report in 1964 started a public health concern over smoking, saying that cigarette smoking is harmful, as we know, and then cigarette advertisements were banned from radio, television, warning labels placed on packaging, and smoking has been banned in many public places. In terms of the legalities here, so tobacco companies had huge lawsuits filed against them in the 90s that required that they basically pay money to demonstrate the ill effects of smoking. So there has definitely been legal action taken against these big tobacco companies like Philip Morris and so forth. In talking about the controversy here over nicotine dependence, is it learning or is it addiction? So proponents of the learning approach or behaviorists see tobacco addiction as a learned habit that is maintained by reinforcers. Research, however, shows that smokers smoke to avoid withdrawal, suggesting that there is some kind of physiological addiction, and smokers self-regulate nicotine levels to prevent those unpleasant withdrawal symptoms from occurring. In terms of looking at treatment, there are a number of ways that you can potentially treat nicotine dependence. There is cognitive behavioral therapy, there's gum chewing, motivational, cognitive, and social factors that come into play here. You might actually be given an antidepressant like Wellbutrin, which has been shown to be effective for some individuals. But there are also other things that come into play here, factors about the individual person. So for example, you're more likely to relapse if you're in a bad mood, or if you see advertisements, or if people in your immediate environment are using nicotine. You're more likely to relapse. So this chart here shows usage of other drugs over the past couple of decades here, basically indicating that it looks like cigarettes have stayed relatively consistent, and for the most part it looks like marijuana or other illegal drugs are going down a little bit, but we'll talk about each of these in greater detail. Okay, so first classification of drugs, we have opiates. These are depressants. So they slow down activity in the central nervous system. They induce a sense of kind of relaxation. And about half of all people who use opiates will become dependent on them. So these are highly addictive, have a high potential for addiction. Heroin is actually the most widely abused opiate in the United States, has those very unpleasant side effects from withdrawing. So when you're not using the drug anymore, individuals experience anxiety, physical symptoms like sweating, nausea, vomiting, body aches, hallucinations. So for many individuals, it's really, really difficult to get off of these drugs, particularly because the side effects are just so unpleasant. Other classifications of depressants, barbiturates. So barbiturates have a sedative effect. They relieve tension and bring relaxation and sleep. Oftentimes, they are used by the young and generally for recreational practices. There is a quick increase in tolerance. So often individuals start using these as a way to sleep, but then, over time they have to use more and more and more of them to get a similar effect. Okay, let's talk about tranquilizers. So tranquilizers used to treat anxiety disorders and stress-related physical disorders. So tranquilizers tranquilizer examples include things like Valium, Xanax, Klonopin, and Ativan. So if you went to see a general practitioner and complained about anxiety, they would probably provide or prescribe some kind of tranquilizer for you. Okay, so stimulants, these increase activity in your central nervous system. So amphetamines are a group of synthetic stimulants. Most common are benzodrine, dexedrine, and methadone. Meth and cocaine fall into these particular categories here. Irregular use and low doses appear not to pose any behavioral or psychological problems, but the problem arises when people use these regularly and use them at high doses. And tolerance absolutely develops over time. Oftentimes, individuals who abuse amphetamines experience these delusions, particularly delusions, paranoid delusions, and delusions of persecution. Okay, so talking about one particular kind of stimulant, looking at cocaine. So with cocaine, a number of things happen here. The particular experience, that paranoia. After the drug wears off, you have this crash where you're very unmotivated, perhaps depressed. It suppresses appetite, so you feel that you don't have a need to eat. If you are taking the cocaine through your nose, snorting it, this messes with your mucous membranes in your nose, and so your nose can often bleed or be just really runny all of the time. In one particular study where they surveyed individuals who called a cocaine hotline, they asked them, why do you use? And euphoria, so that intense pleasurable feeling, the high that comes with the drug, was the primary reason. And then they asked individuals, where cocaine ranks in terms of importance, and found that cocaine was more important than food, family, and friends. So a very, very powerful drug that can absolutely take over parts of your life. Other psychoactive substances, hallucinogens. So hallucinogens act on the central nervous system, and they basically cause some kind of distortion in your sensory perception. So there are many different types of hallucinogens. LSD, or lysergic acid diethylamide, was synthesized in 1938, and it interferes with processing of information in your nervous system, and it causes these hallucinations. So perceptions of color and images, changes in body images, and alteration of time and space perception. PCP, phenylcyclidine, cheap, easily available, often mixed with other substances. Overdose is common and extremely toxic. It causes very unpredictable behavior. So individuals can be very calm and then very violent. So they might be fighting with police, wrecking cars, committing suicide, homicide. The violence may stem from this extreme suspiciousness and persecutory delusions that come with use of PCP. And users often do not experience pain, and they're unaware and amnestic for such experiences, so they don't remember. This goes along with this concept of what's called behavioral toxicity. This refers to the tendency of users to harm themselves, again, because they don't experience pain. They don't perceive it when they are on this particular. So moving into other psychoactive substances, marijuana and hashish. Some people classify marijuana as a hallucinogen. Some people classify it as a mild stimulant. It's one of these substances that kind of defies classification. If we look at marijuana as a dangerous drug, effects of prolonged heavy marijuana use on blood levels of the male sex hormone testosterone, it appears to suppress that. Chronic marijuana use also impairs function of parts of the immune system. It could actually injure your lungs. However, for most people, this is not going to be more dangerous than, say, smoking cigarettes, for example. And using marijuana as a medical treatment is something that is, definitely in the news right now. Marijuana can be useful in treating certain medical disorders. It decreases nausea and increases appetite in cancer patients who are undergoing chemotherapy. It could help with glaucoma by relieving the pressure in the blood vessels behind the eyes that causes the pain in glaucoma. AIDS patients might take it too. So it could represent an alternative treatment for individuals who are open to the idea.